Hey doctors, my spouse is constantly moving in bed and fidgeting his legs just have a mind of their own. They're like moving around side to side and jumping. They literally jump in front of me. When I try to tell him to stop, he says he can't help it.
I just get this overwhelming feeling inside me that is just uncomfortable, and the only thing I can do is kick my leg to get rid of it. I mean, it gets stronger and stronger, and I try and fight it, but you can't stop it. You know, you can't not twitch your legs.
Ed, seriously, I know he's frustrated, and I'm frustrated, and I would really love to get a good night's sleep. Is there anything that you can do to help us? It's driving me crazy. Seriously.
That was Dawn and Ed Hall, who many of you may recognize as the voice from The Tonight Show. Welcome to both of you. And I have to ask you, Ed, did you ever think Dawn was going to write into the show about your legs?
No, I had no idea at all, actually. But, you know, I agreed to come because I wanted to make sure that she realized that it wasn't something that I was doing on purpose. I wasn't trying to annoy her, and it honestly is not my fault.
I love this because it really isn't your fault. We have sleep expert Dr. Michael Bruce join us via Polycom. So, Dr. Bruce, you heard the tape.
Yep.
You heard Dawn's complaints. Why is this not Ed's fault?
Well, there's a couple of different reasons. It appears as though he may have a situation called restless leg syndrome. And what restless leg syndrome is this constant urge or need to move your legs, and when you do move your legs, that urge disappears. It usually only happens in the evening and almost exclusively when you're lying down.
And for anyone at home, because I know a lot of people who have this similar complaint, number one, how do you get diagnosed, and what can you do about it?
There is an interesting situation with some people with restless legs where they actually have a low level of serum ferritin in their blood, which is a type of iron. And so what many people can do is go and get a blood test looking at their ferritin levels, and if they're in the low but normal range, below 60 micrograms per milliliter, then sometimes it's as simple as an iron supplementation can actually help someone.
So obviously that's something that you should do. As far as other treatment options, exercises that Ed might be able to take part in?
There are several different things that he could do during his daytime hours that might be able to affect his nighttime movement. Number one is if he's a smoker, cutting down on nicotine. If he's a coffee drinker, cutting down on caffeine. Daily exercise and stretches help. And believe it or not, there was a study that showed that sexual activity before bed actually helps with this.
Now we're talking.
What we think this might be, other than the potential for it to be an iron issue, is a dopamine issue. And we know that nicotine and caffeine both can reduce the amount of dopamine. So it could in fact be something along those lines as well. He can do some stretches before bed, even just sitting off the end of the bed and flexing his feet up and then flexing them forward, flexing his feet up and flexing them forward, almost like a Babinski reflex. What you would see is he'd be able to kind of loosen up that area a little bit and probably have less of a need to do this. And of course, he probably, if these things don't work, should consider talking with his physician about further testing and maybe even considering some type of medication.
How's this for a nighttime routine? Stretch, sex, and then sleep.
See, there. I like that.
Well, one other thing that could help is some kind of cognitive behavioral therapy that involves relaxation exercises and meditation, because that's where the mind-body component can be addressed.
What's great is these tips apply to anyone at home if you're dealing with this type of issue, so try to incorporate some of these tips into your own life. Dr. Bruce, thanks as always, and Ed, I'm going to ask you a favor.
Sure.
You did on The Tonight Show. Will you come up here and do the throw to break?
Oh, sure. I'd be happy.
You didn't know we'd put you to work.
No. Hey.
You know what? It's all yours, my friend.
Right. To learn how to get the best night's sleep, visit thedoctorstv.com. Coming up, the real reason why women cry more than men. Find out why next.